Alepa will help to reduce pain immediately. That is the simile told for uh, the effect of Alepa. In Alepa, it also helps in means clearing the wound as well as to promote the healing. And when it is a depressed wound, this Alepa helps to make it elevated also. So that is about Alepa. Then Parisheka is told, Atashmofitu Vedanopashamartham, Sarpis Tailadhanyamla Mamsarasa, Vatahara Aushadam Nishpadhe Rashide, Parishekan Kurvita, Vitarakta Abhigata Vishanimitteshu, Kshira Krita, Madhu Sharkara Udaka, Ikshurasa, Madhura Aushada Kshira Vriksha, Nishpadhe Ranushne, Parishekan Kurvita, Sleshma Shofetu, Taila Mutra Ksharodaka, Sura Shukta, Kafakna Aushadha, Nishpadhe, Ashide, Parishekan Kurvita, यथा अम्बुभिः सिच्यमान शान्तिमग्ननियच्छति दोषाग्निदेवं सहसा परिषेकेण शामेति. So parisheka, local irrigation of different kinds of kashayas, it is told, and that helps in uh, normalizing the vitiated doshas. It will pacify the aggravated doshas, and based on the dosha vitiation or based on certain factors, the drugs which can be used, that is suggested. That is in Vataja condition, it is advised that Sarpi, Taila, Dhanyamla, Mamsarasa and Vadahara Aushada can be used for preparing Kvadha, and that can be used in Ashita. That is, should not be Shita, it should be used in a warm form. And in case of Pittaja, Raktaja and Abhigataja Vrana, means Abhigataja Shofa, it is told that we can use Kshiri Vriksha Dravyas or Dravyas having Madhura Rasa to prepare this Kashaya, and that have to be used in Anushna. Anushna means it should be cold decoction should be used because it is Pittaja, Raktaja and Abhigataja condition. Then it is told about Kafaja. There also the Dravya suggested as Taila, Mutra, Ksharodaka. This Kafakna Dravyas are told, and it should be used in Ashita. That too, in a warm form, it have to be used. And here also one simile is told that similarly, means how the uh, water extinguishes the fire when it is poured over the uh, ignited fire. What happens? This Parisheka will helps to pacify or it will relieve the doshakni. That is, the vitiated doshas will be normalized with the help of this Parisheka. There it was the pain which was relieved immediately by action of Alepa. Here it is told that the doshakni shamana will be there when we use Parisheka. That is the simile told. Then next is Abhyanga. Abhyangastu doshamalokya upayukto doshopashamam gudam cha karoti. Sweda vimlapanadinam kriyanam praksa uchyate paschat karmasu cha adishta sacha visravanadishu. That is, Abhyanga will help in when it is done based on the vitiated dosha, it will help to pacify the vitiated dosha and it will bring about softness to the area. And it is told that it can be used as a purva karma in case of Svedana and Vimlapana, and a paschat karma for means after Visravana. Then next is Svedana. Rujavatam darunanam kadhinanam tathevacha shofanam swedanam karyam yechapi evam vidhagana. So Svedana can be done over swellings which are hard and painful, and means Abhyanga and Svedana will in Panchakarmas, like you know, means Abhyanga, the Purva Karma will help to liquefy the doshas. The dosha will be brought to the Koshta, and then after that proper Shodhana can be done to remove the vitiated doshas. So for that also Svedana is indicated. Sthiranam Rujavata Sthiranam Rujata Mandam Karim Lapanam Bhave Abhijyas Vedetatu Venunadiyatashani So the spellings where it is hard or fixed and where it is less painful, then that can be given Vimlapana. That is, it is told for Shofa Vilayana. That pressure is applied over the swelling to liquefy the swelling, and that can be done with the help of so Vimlapana Sthirana Rujata Manda Karim Vimlapanam Bhavet Abhyajya Svedetva tu Venunadya Tatashani Vimate Bhishak Pratnya Talena Angushtakenava. The swellings which are firm or fixed and which are less painful, that have to be pressed to do get the Shofa Vilena, that is to reducing, we will be pressure over the swelling, and that can be done with the help of Venunadi, Pada, Panitala and Angushta, that is by help of fixed. About Upanaha, Shofe or Upanaham to Puryadam Vidaktayo, Avidakta Shamam Yati, Vidakta Pakam Edicha. So, Upanaha, that can be done to suppress the Vrana Shofa in the Amavastha as well as the Vidagdhavastha. That is, in Amavastha, it can be suppressed. When you use Upanaha, it can attain the Shama Avastha, means Avidagdha Shamam Yati. In the Amavastha, it will get suppressed, and the Vidagdha Avastha, what if it is done, if Upanaha is done, then that will attain its Pakavastha. With the help of this Upanaha, Pakavastha will be attained. So in both Amavastha as well as in Vidagdhavastha, this Upanaha can be done either to suppress the Ranashofa or to accelerate the Vidagdha Avastha to Pakavastha, and thereby it will break open on its own, and that, or it can be subjected to incision and drainage procedures. So that is about Upanaha. It can be used in Ama and Vidagdhavastha. Next is Pachana Nivartate na yashofo Virekante Rupakramai Tasya Sampajanam Kuryat Samahritya Aushadanitu Suri Takra Surashukta Dhanyamle Ryojitanitu Snigdhani Lavadikritya Pajedutkarikam Shubham Sairenda Patraya Shopam Nahiye Dushnayataya Hitam Sambhojanam Chapi Prakaya Abhimugo Yedhi. So when the shofa does not reduce by the above procedures, then we have to it should be made to undergo separation or pachana with different kinds of methods. For that, it is told that we can use drugs like Shanamulaka Bija, etc., and mixed with Dadi, Daktakra, Surashukta, Dhanyamla, etc., and can be mixed with Sneha and Levana. This will help, and this can be applied over the shofa and can be covered with Erinda Patra. This will help in the Pajana, means it will be attaining separation with the help of this method. So that is about Pajana. And during this procedure, it is advised that the patient should take ahara, which is Ushna and Snigdha, that is, which will help in the separation of the Vrana Shofa. Such kind of diet have to be advised during the procedure. Next is Visravana. Visravana, it is told Vedana Pashamarthaya Tadha Pakashamaaya cha Achirotpatite Shofe Kuryat Shonita Mokshanam Sa Shofe Kadine Dhyame Sarakte Vedana Vanati Samrabdhe Vishme Chapi Vrane Visravanam Hitam Savishecha Visheshena Jalokopi Padestata Vedanaya Prashantyartam Pakasya Aprapte Tatha. So in swellings of recent origin, the Visravana when done, it will help to relieve the pain and swelling, and it can be used in the shofa, which is irregular, which is tense, hard and red in color. And in case of Vrana contaminated with Visha, Jaloka can be used for Rakta Mokshana. So here, when the Rakta is one of the major dosha for the causation and complication of Prana, when the vitiated Rakta is removed by Visravana, the disease process itself get weakened and the patient is relieved of the complaints. Next is Snehapana. Snehapana, Saupadravanam, Rukshanam, Kushanam, Vranashoshinam, Yadhasam Aushade Siddham, Snehapanam Vidhyade. That is Vrana Shofa in a person who is Ruksha, Krisha, and suffering from Ubhadrava of Vrana has to be managed by Snehapana. Different sneha can be prepared with dravyas according to the vitiated dosha. This snehapana will control the vitiated vata. It will increase the jadaragni and the advagni, and it will help in reducing the shofa. Next is Vamana. Utsanna Mamsa Shofetu Kafajushte Visheshada Sanklishta Shama Ruthire Brane Prachadanam Hita. So the shofa that is caused due to the visheshan of kapha, when the visheshan of kapha is severe, due to which the area has become black, and in the brana which is filled with excessive slough. In that conditions, Vamana can be beneficial. Next is Virejana. Vadapitta Pradushteshu Dirghakala Anubandhishu Virejanam Prashamsanti Praneshu Vranapuvita. So, Shofa was due to the visheshan of Vata and Pitta, those which are long standing. In that conditions, Virejana is advised. Next is Chedana. Till this, it is included under the Ekadasha Upakrama. Starting from Apatarpana, ending in Apatarpana Dev, Virejanantya. That is told as Ekadasha Upakrama. And next, it is about Chedana. Chedana, it is told, Apakeshu Turogeshu, Kadhineshu Stireshu Cha, Shnai Bodhadishu Tadha, Chedanam Tapamachite. That is, Chedana is excision. So, in conditions which is caused due to the visheshan of Kapha, Medas and Mamsa, in case of Kadhina and Stira, Ranashofa, the Ranashofa which is Apaka and which is filled with dead or necrose Snayu Kodha, and it is filled with Snayu Kodha or slough. In that condition, Chedana is indicated. Then Bhedana, Antapuyeshu Avaktreshu, Tatheva Utsangavatsvapi, Gatimatsu Charogeshu, Bhedanam Praptamuchite. So, Bhedana is incision. That is when a shofa is filled with pus. Antapuyeshu Avaktreshu, and there is no opening which is naturally present for the discharge of the pus. Tatheva Utsangavatsvapi, when the swelling is raised. Gatimatsucha rogeshu bhedanam praptamuchite, and absence of opening results in formation of deeper tracts or sinuses will be present. In such conditions, it will be bhedana which is indicated. Next is dharana. Balavritta saha Sheena Bhirunam Yoshitamapi Marma Uparija Jadeshu Rogeshu Peshu Dharanam Supakve Pindide Shope Pedane Rupapetite Pagodvruteshu Dosheshu Tattukaryam Vijanata Supishter Dharana Dravir Yukte Ksharena Vapuna. So, Vranashofa manifested in children, elderly, delicate and emaciated persons, women, and when it is over a marma, when pakwa and localized, and can be opened by application of paste. That is called dharana. Dharana, or can be considered as a medical way of draining the pus. The labor will create pressure over the sofa and it will help to drain out the pus. That is dharana. It can be done using shara also. Dharana procedure can be done with the help of shara also. Then it is lekhana, which is told Kadhinan Stula Vruttoshan, Liremanan Punapuna, Kadhina Utsanna Mamsascha, Lekhanena Acharetvisha, Samam Likhet Sulikhitam Likhet Niravasheshata, Patmanam tu Pramanena, Samam Shastrena Nirlikhe. Shamam, Plutam, Pijum, Fenam, Yavashukam Sasaindavam, Karkashanija Patrani, Lekhanartham, Pradave. That is Lekhana is scraping, that is when the margin or the edges have become hard and thick, and the edges, when it get peeled off repeatedly, or when there is excessive tissue, granulation tissue in the floor which is very hard, Lekhana can be done. This removes the hard stuff or callous tissue, and this will induce good circulation to the area, and thus it can promote the healing. And for Lekhana, it is told like Sulekha, Samalekha, Nirlekha. Sulekhana means mild scraping, Samalekha means moderate scraping, and Nirlekhana indicates the complete scraping. So it is also told that the procedure of scraping can be done using different instruments or materials like Shauma, Plota, Pijufena, Yavashuka, or different kinds of leaves. That is Karkasha Patra. Different kinds of leaves like Shepalika Patra, Parijata Patra, etc. also can be made use of for doing Lekhana. Then it is Ashana. Ashana it is told Nadi Pranan Shalya Garbhan Unmargi Utsangina Shanai Karira Bala Angulibhir Ashanya Eshebhisha Netravatma Gudabhyasa Nadyo Avaktrasa Shonita Chuchupodagajai Shlakshne Karire Shetuta. So, in case of Vrana, which is associated with deep sinus, when it is having a foreign body inside it, when it has sinuses running upwards, or it is a large cavity inside, in that cases, as well as in order to confirm the presence of foreign body, depth of the cavity, extent and direction of the tracts or sinuses, one should probe the Vrana, and that can be opened or untreated. That is Ashana. Aseshu, Vraneshu, Matiman, Krishna. Hello? So, Chedana, Apakeshu tu rogeshu, Kadhineshu, Stireshu cha, Snayukodhadishu tatha, Chedanam praptam uchyate. So, Chedana is excision, and it is told like it is indicated in conditions which visheshan of kapha, medus, and mamsa, and in Rana Shofa, which is apaka, that is which do not separate and which is hard or it is fixed. And when it is Snayu Kodhadishu, then when it is filled with dead or necrosed Snayu, that is slough is present inside. In that conditions, excision is indicated or Chedana is indicated. Next is Bhedana. Antapuyeshu avaktreshu tatheva utsangavatsvapi gatimatsu cha rogeshu bhedanam praptamuchyate. So, Bhedana is the incision. So, it is told incision is indicated in shofa filled with pus. It is Antapuyeshu, the shofa which is containing pus inside, and Avaktreshu. There is no opening which is naturally present to the discharge of pus in such a shofa, and when the shofa is raised and when there is absence of opening, that will result in the formation of deeper tracts or sinuses. So in such a condition, Vedana or incision is indicated. Next is Dharana. Dharana it is told Balavratha Saha Kshina Bhiruna Yoshitamapi Marmoparicha Jateshu Rogeshu Ukteshu Dharanam Supakve Pindide Shofe Pidana Pidane Rupapidide Bhagodvriteshu Dosheshu Tattu Karyam Vijanata Supishte Dharana Dravyer Yukte Ksharena Vapuna. So in Rana Shofa, which is manifested in children, elderly, delicate and emaciated person, a person who is a coward, in women, and when the Vranashofa is situated over a marma, then such a Vranashofa, when pakva and it is getting localized, that can be opened by the application of different kinds of dravyas. That is, here, when the indication when you see it, we can take it as those who are shastra saha. So in such a condition, when there is pakvavastha and where we cannot go with the shastra karma, it is advised that dharana can be done by applying different pidana dravyas. That is the dravyas which can be mm, made into paste and applied over the swelling, so that as the lepa dries, as the paste of the drug gets dried, that will create a pressure over the shofa, and thus the uh, pus will be drained out, so that there is no necessity of a surgical procedure. So dharana is a medical way of draining the pus, and for this kshara also can be applied for the same purpose. Next is lekhana. Kathina sthula vrittaushtan dīryamanan puna puna kathina utsanna mamsascha lekhanena acharedvishak samam likhet sulikhitam likhet niravasheshata पद्मनां तु प्रमाणेन समं शस्त्रेण निर्लिखे क्षौमं प्लोदं पिजुफेनं यावशोकं ससैन्धवं कर्कशानि च पत्राणि लेखनार्थं प्रदापयेत्. So here it is told lekhana is scraping. So where and all scraping is indicated. This is when the margin or the edges have become hard and thick, when the edges gets peeled off repeatedly, when there is excessive tissue in the floor, the too which is hard, the Lekhana can be done so that this removes the hard, slough or callous tissue, thereby induces good circulation to the areas and thus promotes healing. And here, three types of lekhana is told, like Sulekhana, Samalekhana, and Nirlekhana. Sulekhana means mild scraping, Samalekhana moderate, and Nirlekhana means complete scraping. And it is told this procedure of lekhana can be done using shastra, and in absence of shastra abhave, it is told like materials like shauma, plota, pichu, fena, yavashuka, saindava, means Yavashuka Saindava, that is along with Saindava, these materials by keeping Saindava over it, that can be rubbed over the area and Lekhana can be done, or else the rough leaves, Karkasha Patra like Shefalika Patra, Parijata Patra, etc. also can be made use of. The next is Eshana, Nadi Vranan Shalya Garbhan Unmargi Utsangini Shanai, Harira Bala Angulibhir, Eshanya, Veshayid Bhishak, Netravatma Gudabhyasa, नाड्यो अवक्त्रा सशोणिता चुचुपोदगजै लक्ष्णे करीरे रेशयतु सा. So Ashana, it's probing, that is when the vrana is associated with deep sinuses, when it is having a foreign body inside it, when sinuses are running upwards, when it's having a large cavity inside. In order to confirm the presence of foreign body, the depth of the cavity, extent and direction of the tract, one should probe. That probing can be done with the help of creepers, hairs, fingers, or the instrument Ashani, so that none of the tracts or cavity are left unopened or untreated. That is Ashana. Next is Aharana, Samvrita, Asamvritaseshu, Raneshu, Matiman Bhishak, Yadhoktam Aharet Shalyam, Praptodharana, Lakshanam. So, Aharana, that is Rana may be open or not open. Once the Udharana Lakshana, that is when it is showing the Pakwa Lakshanas, or when it is not a condition of uh, when the location is not like Vishalyakna, then that is once the foreign body is removed, that will cause complication. When that is not the condition, then we can adopt appropriate measure, and with appropriate precaution, the shalya can be extracted. Yadhoktam ahare shalyam, that is the extraction can be done. That is whatever the material present is causing the formation of abscess or preventing the healing of rana, that is considered as the shalya and that can be removed. If it is not a condition of sadhya pranahara or vishalyagna marma location, so that is aharana. Then next is Vyathana. Roge Vyathana Sathetu Yadhodesham Pramanata Shastram Nidadya Dosham Cha Shravayet Kirtitam Yatha. That is in diseases which can be treated. Here Vyathana and Visravana is told together. That is in diseases which can be treated by puncturing and draining. Vyathana and Visravana, like in case of the Godara, ascites, or in case of retention of urine, etc. One should puncture with instruments and drain the ideal quantity according to the condition of the disease as well as the patient. The draining can be done, so it will help in specifying the vitiated dosha. And in case of vidradi also this is applicable, that is that the pus will be drained out. Next is Sivana, Apago Badrude, Ubadrudaye cha Mamsasta Vivratashaye, Yethoktam Sivanam Teshu, Karyam Sandhanam Evacha. So wounds which are deep, wide open and show no signs of Paka, that have to be closed by Sivana or Sandhana. Using Suchi and Sivana Dravyas, the edge of the wounds can be sutured and that will help in early healing. Next is Pidana, Puya Garbhan Anudwaran, Ranan Marmagadanapi, Yadhokte Pidana Dravye, Samantat Paripidayet, Shushyamana Upeksheda, Pradeham Pidanam Prati, Nacha Abhimukam Alimpe, Tadha Dosha Prasichyate. That is when the Vrana Shofa has reached the Pakva Avastha and it is filled with Puya, the opening is not wide and it is situated over the marma, similar to Dharana it is told. That is, we can apply certain lepa that will help, that when dry will help to squeeze out the pus from the opening present. So that is the Pidana. In Dharana it was when there is no opening present, and here it is when the opening is narrow. Through the opening the pus will be draining out with the help of lepa. Pidana dravyas are used here also. Next is Shonita Sthavana, Taister Nimitter Bohuda, Shonite Prasrute Prasham, Karyam Yathoktam Vaidyana, Shonita Sthavanam Bhavit. That is arresting the bleeding. That procedure can be adopted whenever there is significant bleeding secondary to any of the procedures. And Sandhanam Skandanam Shiva, Pachanam Dahanam Tada. Those are the Chaturvida Raktastambana Upayas told by Acharya Sushruta. Same can be adopted here also. Next is Nirvapana, Dahapaga Jwaravatam, Prananam Pittakopada, Raktena cha Vibhutanam, Harim Nirvapanam Bhavit, Yethokte Shitala Dravik, Shira Pishter Kritaplude, Dihyat Abahalan Sekan, Sushitas cha Avacharayir. So, in the Vranita, where there is aggravation of Pitta and associated Rakta and suffers from Daha, Paka, Jwara, etc., then irrigation with decoction can be done. Then for this purpose, it is advised that we can use Shitala Dravya, that too mixed with Kshira Pishta, Krita, etc. And that can be Dihyat, Abahalan, Sekan, Sushita, Chavacharya. It can be irrigated over and around the Vrana, and that should be Sushita. Shita Dravyas can be used, and it should be done in the Shita form also. Next is Utkarika, Praneshu Kshinamamseshu, Tanusra Vishwapakishu, Todakaഠिन्य Parushya, Shulavepadumatsucha, Vadakna Varge Amlagane, Kakulyadigane Tatha, Snehikeshu cha Bijeshu, Pachet Utkarikam Shubham, Tesham just Vedanam Karyam, Stirana Vedanavata. So, Utkarika is advised when the Vrana Pachana is not occurring completely and Vrana is associated wasting of Mamsa. And when the site is hard, there will be pain and thin discharge associated. In that case, Karika can be prepared with different drugs, that too, which acts as Vadakna. In Vadakna, Varga Dravyas can be selected and that can be applied in the warm form. So it will produce a Svedana effect. Next is Kashaya. So Kashaya, it is told Kashaya to Churna. That 7 procedures, it is told that both Shodhana and Ropana action is based on the condition of the wound. Shodhana Kashaya and Ropana Kashaya can be used. Similarly, in the coming slides, Varti, then Sarpi, Taila, etc. These are to be advised in both Shodhana and Ropana Avastha. That is in Shodhana, means in a Vrana which is in which there is Shodhana needed, then we have to go for Shodhana Kashaya. And once the Shodhana is attained, when the Vrana is Shuddha, then for Ropana Kashayas can be advised. So similarly, there is reference for Svarti, Sarpi, Daila, etc. So for Kashaya, it is told Durgandhanam Kledavadam Pichilanam Visheshata Kashaye Shodhanam Karyam Shodhanai Pragudirite. That is Vrana which is fetid, foul smell is there, excessive slimy discharge is there. Then in that condition, we have to do Kashaya, have to be prepared using Shodhana Dravyas, and that can be used in cleaning the Vrana. There it is told like Kashaya prepared of Surasadigana, Aragodadigana, etc. are best for the purpose. And also it is told in later shlokas, it is told Shuddha Lakshana Yuktanam Kashayam Ropanam Hidam Tatra Karyam Yadhodishte Dravir Vaidyena Jana. Is once the Shodhana is attained, then we can go for Ropana Kashayas. So according to the condition of the Brahna, Shodhana or Ropana Kashaya can be selected. Similarly, for Varti also it is told Antashalyan Anumukhan Gambhiran Mamsa Sanskritan Shodhana Dravyuktabhir Vartirbhistan Yathakramam Puti Mamsa Pradichannan Mahadoshansha Shodhayir Kalki Kter Yathalapam Vartirdravye Purodide. Shodhana Gana Dravyas are made into Varti and that have to be inserted into the Prana, which is having Shalya inside it, which is having narrow openings and which are deep seated. This Varti will helps to clean the slough and it will make the opening wide to drain out the pus and thus helps in early cleansing of the wound. Then it is told Avedana Ropana. It is Shuddha, then we can go with Ropana Varti. Next is Sarpi. Pitta Pradushtan Gambhiran Daha Paka Prapititan Karpasi Phala Mistrena Jayet Shodhana Sarpisha. Krida can be prepared with Shodhana drugs like Sisa, Karpasaphala, etc. And that can be applied over the deep-seated Vrana, which is associated with Daha, Paka, etc. And that is helping in cleaning the Vrana. and thereby it will help in early healing. Otherwise, if it is Pitta Rakta Vishagandun Gambhiran Apicha Vranan, Ropet Ropaniyan Kshira Siddhena Sarpisha. When it is not a Shuddha Vrana, then we can go with Krida prepared with Ropana Dravyas, and thereby it will help in the Ropana process. Next is Taila. It is told Utsanna Mamsan Asnigdhan Alpasravan Ranastada Sarshaba Sneha Yuktena Dhiman Stailena Shode. In the cleaning of Rana, which is raised, Ruksha, there is Mamsa is present with, there is scanty discharge and all. There we can go for Taila prepared with Shodhana drugs. Sarshaba Taila or Tila Taila is best for the case. And once it is Kafavada Bhutana Pranana Madiman Bhishak Are Dropanam Tailam Bheshajai Tadyadodide. That is when it is attaining the Shuddha Avastha, only the Ropana process is needed, then we can go for Ropana Taila in this case. Kalka. Kalka it is told Apeta Poti Mamsana Mamsastana Manohatam Kalka Samrohana. Kalka Samrohanam Karya Tilajo Madhu Samyuta. Samadhurya Tadhaushnyasha Snehacha Anila Nashana Kashaya Bhavan Madhurya तिक्तत्वाचापि पित्तहृत् औष्ण्यात् कषायभावाच्च तिक्तत्वाच्च कफे हिता शोधयेत् रोपयेत् चापि युक्तशोधनरोपणे निम्बपत्रमधुभ्यां तु युक्तसंशोधनस्मृता पूर्वाभ्यां सर्पिष्ठा चापि युक्तश्चापि उपरोपण तिलवद्यवकल्कं तु केचिदाहुर्मनीषिणा शमयेत् विदग्धं च विदग्धमभिभाजयेत् पक्वं भिन्नति भिन्नं च शोधयेत् रोपयेत् तदा. This kalka, when the prana is covered with excessive necrosed tissue, when the doshas are activated in excessive manner, they have to be cleansed. For that, Shodhana Dravyas are made into kalka, and that can be used for that. And the paste prepared of patola, tila, yashti, etc., along with saindava, that will help in complete cleansing. And the kalka, it acts as ropana also. And when in Shuddha Vrana, when it is needed to help the Ropana process, then we can go for Ropana Dravyas. And it is told that the Kalka can be used in different forms. That is in Shama Avastha, in Avidakta Avastha, certain Kalka can help in attaining the Shama. And in certain cases, the Vidagda Shofa can be changed into Pakwa Avastha. And Pakwa, it can be given Bhedana by the action of certain drugs, and certain drugs or the certain kalka will help in shodhana and ropana. So based on the drug selected, the kalka procedure can act differently. Next is rasakriya. So in rasakriya also tailena ashuddhyamananam shodhaniyam rasakriya, and then it is told how the rasakriya have to be prepared. That is rasakriya is it is used to cleanse the prana which is hard, which does not undergo shodhana in spite of the usage of above sneha. In that condition, rasakriya is used. Here, what is done is the decoction of the shodhana dravyas. Kashaya is prepared, and then it is continued to be boiled. And to this, Saurashtraja, Kasi, Saharatala, etc. are added, and again it is mixed till a consistency similar to an ointment is achieved. Then it is removed from the flame, and then matulanga rasa, madhu, etc. are added, and it is again mixed well. Then this paste is applied to the vrana, and it is left over for 3 days and then washed on the 4th day. It will help in the cleansing as such. And similarly, when it is shuddha and when the other features are not present, then we can go for ropana rasakriya, and that can be prepared using dviharidra, 2 types of haridra. That is rasakriya. Then avachurnana is told samanam stiramamsanam tokstanam ropanam bhishak churnam vidadyad matiman prakstanokta vidharyada. That is dusting powders. Whatever drugs can be used for shodhana, that can be made into powders, and that can be dusted over the prana, which are deep seated, foul smelling, and covered with slough. Then it is told Adye Dve Panchamulyotu Gano Yaschanlapa. That is the drugs which can be selected for different based on the visheshan how the drugs can be selected. It is told in Vata Dushta, it is told Panchamuli. That is Panchamuli, Panchamula, it's Dashamula drugs can be used for preparing medicine in case of Vataja condition. Negrodhadigana can be used for um, or Kakolyadigana can be used for Pittaja condition and Aragodhadigana can be utilized for Kafaja condition. And in case of Samsrishta Samyuta, it means in Samsargaja and Sannipataja condition, mixture of these ganas or the dravyas from different ganas based on the features or based on the dosha vitiated can be selected. So in Vataja condition, Dve Panchamulya, that is Dashamula Gana Dravyas can be taken. Then in Pitaja condition, Negrodadiyan or Kakolyadi, and in Kafaja, Aragwadadi. That should be the and Samsargaja and Sannipadaja, the all kinds of drugs based on the vitiation. That is the selection of drugs that have to be made. Next it is Dhupana. Vadatmakan Ugrarujan Sasravan Api Chavranan Sakshauma Yava Sarpibhir Dhubanangesha Dhuped. That is Vrana associated with vitiated Vata, severe pain, discharge, etc. that have to be treated with Dhupana. That is the wound should be exposed to smoke of Kshauma, Yava, Krita, etc. or other Dhupana drugs can be ignited and that smoke can be given to be exposed to the wound. So that is Dhupana. Next is Utsadana, Parishishkalpamamsanam, Gambhiranam Tadevacha, Puryad Utsadaniyani, Sarpimshi, Alepanani cha, Mamsashinam cha Mamsani, Bhakshayet Vidivadnara, Vishuddha Manasastasya, Mamsam Mamsena Vartate. So it is Utsadana is indicated in which the prana is very dry, deep and associated with loss of tissues, that is depressed wounds. There we have to elevate the level of the floor of the wound to that as that of the surrounding area. So for that it is told like we can give different kinds of brahmana dravyas and people who are habituated to meat, for them it is advised to take meat so that it will help in the promotion of the growth. So Utsadana means elevating the procedures which help in elevating the level of the floor of the ulcer to that of the surrounding skin. Next is Avasadana, where it is Utsanna Mrudumamsana, that is the condition where there is granulation tissue is more than that of the surrounding skin. So in that case, we have to reduce the level of the floor by applying different drugs. And in that case, Kshara, etc. can be made use of, and other drugs like Jate, Kasisa, Manashila, etc. also can be used for this purpose. Next is Mrudu Karma. कठिनानाम् अमांसानां दुष्टानाम् आतरिश्वनां मृद्वीक्रिया विधातव्या शोणितं चापि मोक्षयेत् वादक्नौषधसंयुक्तान् स्नेहान् सेकाश्च कारयेत् मृदुत्वम् आशिरोहं च गाढो बन्ध करोति. So vrana which have become hard with scanty tissue due to the visheshan of vata, that have to be given mrudu karma so that the area will get softened and the healing will get started. For this purpose, Madhura Snigdha Dravyas can be used locally and internally. Sneha prepared with Vatahara Dravyas can be used for Snehana, Parisheka, Lepana, etc. Raktamokshana can be done. And after Lepa, Gada Bandha also can be given at the site. Then Daruna Karma, Praneshu Mrudumamseshu, Daruni Karanam Hitam, Dhava Priyanga Shokana, Dhava Priyangu Ashokanam, Rohinyasha Tatvajastada, Trifaladataki Pushpa, Rodha Sarjarasan Saman, Krutva Sukshmani Churnani, Pranam Taira Vachurni. So for Daruna Karma, it is told when during the process of healing, the prana area becomes fragile or soft, that area have to be hardened to the normal tissue strength. So for that, the Aruna Karma have to be done. For this, it is advised to use fine powders of bark of, it is told, bark of Dhava, Priyangu, Ashoka, etc. can be used for Avachurnana. Fine powders of these drugs have to be made and that can be used for Avachurnana. That is for the purpose of Daruna Karma, for making the area hard. Next is Kshara Karma, Utsanna Mamsan Kartinan, Kandu Yuktan Shirothidan, Tadheva, Khalu Dushodhyan, Shodhe, Kshara Karmana. So during the process of Ropana, if the Brana site gets filled with excess raised tissue, And when it is hard or callous, associated with itching, when it is chronic and when it's difficult to cleanse, then we have to apply Kshara to the Vrana site. That will help in the Shodhana of the Vrana and then Ropana of the Vrana. Next is Agni Karma. Agni Karma, Sravado Ashma Bhavan Mutram, Yechani Raktavahina, Nishesha China Sandesha, Sadhet, Agni Karmana. So it is told after the extraction of Ashmari, when there is discharge of urine from the surgical site, when there is hemorrhage from any site, when there is excised body parts or joints, in such conditions, one should adopt Agni Karma to arrest the hemorrhage and to prevent the manifestation of any other complications. That is Agni Karma. Then it is told about Krishna Karma. Durudhatvat Shuklanam Krishna Karma Hidam Bhave. And then the combination which can be used for Krishna Karma is told. That is, Krishna Karma it is told, Durudhatvat Shuklanam Krishna Karma Hidam Bhave. That is, during the process of healing, when the scar acquires a lighter color or gets discolored compared to the surrounding skin, then we have to do the Krishna Karma. That to make the scar acquire the same color as that of the surrounding skin, Krishna Karma is done. So it is told, Bhallataka Phala. Bhallataka have to be taken and it should be triturated in Gomutra and then kept in cow's milk. Kshira for 7 days, and using Padana Yantra, oil is extracted, and to this we have to add the hooves of different animals, and then this combination can be used to darken the light scar. That is the combination mentioned for Krishna Karma. Bhalladaka Vidhana, that is told. Bhalladaka fruit triturated in Gomutra and kept in cow milk for 7 days, and then the oil is extracted, and then to this ash of means different animals hooves are taken and that is burnt into ashes, and that ashes added to this oil, and this can be applied to the scar area, and that will help in darkening the light scar. That is the procedure of Krishna Karma. The next is Pandu Karma. Pandu Karma, it is told Durudhatvat to Krishnanam Pandu Karma Hidam Bhave, that when the scar becomes darker than the surrounding tissue, we have to go for Pandu Karma. And here it is told Rohini Phala immersed in goat's milk, that have to be done for 7 days, and then it is made into paste with the same milk, and this paste can be applied over the area, and that will restore the normal color. And other than that, application of Manashila, Manjishta, Laksha, Haridra, etc. also mixed with Madhu and Krida, that will also help in normalizing the color of the scar. That is the procedure told for Pandu Karma. Both these deal with the different discolorations present over the area after the healing process or the scar. Next is Pratisarana, Kukkudanda Kapalani, Katakam Madhukam Samam, Tadha Samudra Mandugi, Manichurnam Chadape, Udiga Motra Pishtasta, Prananam Pratisaranam. So, shell of hen's egg, Kataka, Madhuka, Samudra Mandugi, Manichurna, etc. are mixed in equal quantity, and that is made into paste in cow's urine, and that is applied to the site of the scar. That is for the proper, means if there is any cosmetic disfigurement, that can be solved with this application. It is Pratisarana. Then next is Roma Sanjana. So it is told Hastidanta Masing Kritva Mukhyam Chaiva Rasanjanam Romanyete Daleshwapi Chatushpadanam Togroma Purana Tailakta Churnita Bhumir Bhavet Romavati Puna Kasisam Naktamalasya Pallavascheva Samhare Kapitha Rasapishtani Roma Sanjananam Para. So Roma Sanjana, from the term itself, you know, that is growth of hair. So normal growth of hair can be achieved over the scar site by the application of Hastidanta Masi along with Rasanjana and Chaga Dugda. That is, the skin, hairs, hoof, horn, bones of various animals are used for avachurnana of the avachurnana over the ulcer site after the application of Thaila over the site. This will help to help in the growth of the hair. Similarly, Kasisa, Raktamala along with Rasa of Kabitha. that have to be ground into paste, and that also can be applied over the area to help in growth of hairs. That is Roma Sanjanana. And for Hastidandamasi, it is told like Lepat Panitaleshwapi. That is in Panitala also, once it is applied, it can promote hair growth in the Panitala also. That much effect is highlighted in case of Hastidanda Masi. Next is Roma Apaharana. That is Roma Kirno Vrano Yestu Na Samyag Uparohati Kshudakartari Sandamshe Tasya Romani Narhare. That is Roma Apaharana means if there is excessive hair growth occur at the scar site, then that have to be removed. And it is told by using uh, Kshura Kartari Sandamsha, different kinds of yantras we can cut it. Or another thing it is told like Shanka Churna, Haritala, etc. mixed with Shukta, that can be mixed into paste and that can be applied so that it will remove the excess hairs. Or Bhalataka Taila applied along with Snuhikshira is also advised. Then Dirkarunda, Haratala, Saindava, Shami Bija, these can be made into paste with cold water, and that also is advised to be applied over the area where excess hair is present, which helps in the Roma Apaharana. These are the different combinations told for removing the excess hairs. Next it is Basti. Basti it is told Vatadushto vrano yastu rukshascha atyartha vedana adhakaye visheshena tatra bastir vidhiyade. That is Varana caused by the visheshan of Vata when it is Ruksha, when it is associated with severe pain, and Athakaya Visheshana when it is situated in the lower half of the body. In such conditions, Basti is highly beneficial. उत्तरवस्ति मूत्राखादे मूत्रदोषे शुक्रदोषे अश्मरीव्रणे तथैव आर्तवे दोषे च बस्तिरपि उत्तरोहिता. That is Uttarabasti is indicated in Mutrakhada in if any Mutra dosha is present, Shukra dosha, Artava dosha, and in case of Ashmari Vrana. In these conditions, Uttarabasti is indicated. Next, it is told about Bandhana. Yasmat Shuddhyati Bandhena Vrano Yati cha Mardavam Rohatyapi cha Nishanga Tasmat Bandho Vidhiyate. So Bandhana is done in Vrana to make it Shuddha, that is by protecting it from external environment, and by doing Bandha, the Vrana will attain Mruduta. That is especially in case of joints and all, Bandhana will help to retain the medicine over the area. Then by these things, by doing the bandhana, it will help in sealing the wound, and thus it will help in the healing as well. So in that aspect, bandhana is beneficial in the treatment of Rana, both in case of Shodhana as well as Ropana. Then it is told about Patradana. Tiranam Alpa Mamsanam Rakshat Anuparohatam Patradanam Bhavet Karyam Yatha Dosham Yathartacha. So it is told Patradana, that is covering the wound with a leaf. That is done in Prana which are hard, which is having scanty granulation tissue, which is Ruksha, due to which they become hard and show no signs of healing. In such cases, Patradana is indicated, and it is told certain leaves are told which can be used for Patradana. Like in Vataja condition, leaves of Eranda, Burja, Pudika, Haridra, etc. can be used. In Pittaja condition, Ashwabala, Kashmiri, Kshiri, Vriksha, Kamala, and other aquatic plants can be used. In Kafaja condition, leaves of Pada, Murva, Guduchi, such kind of leaves can be used. And leaves should not be rough, means while selecting the leaves it should be noted that it should not be rough, it should not be torn, it should not be old, it should not be very tender, infected with worms, or bitten by any other animals, but it should be soft. That is, by doing Patradana it should not cause any complications. And how it is done is over the Vrana medicine is applied, and then it is covered by suitable leaf, and over that bandhana can be done. The leaf will produce shaitya in Rakta Pittaja Vrana, it will produce Aushnya in Vata Kafaja Vrana, and it will help in preventing the loss of medicine. That is, in if we are applying other materials like cotton, gauze, etc., to cover the wound, it gets absorbed into the cotton or gauze. But if we are using this, that will prevent the loss of medicine like that. So Patradhana thus normalizes the dosha in the Vrana, and it will prevent exposure to dust, worms, etc., and it will help in retaining the medicine laid over the Vrana, and thus it will help in the early healing. That is Patradhana. The next is Krimikna Karma. Krimikna Karma, it is told, Makshika Vranamagatya Nikshibanti Yada Krimi, Shaidur Bhakshite Taistu Jayate Vrishadaruna, Tivra Rujo Vichitrashtra Raktasravashtra Jayate, Surasadir Hitastatra Dhavane Purane Tada, Saptavarna Karanjarka, Nimbaraja Danatvaja, Hida Gomutra Pishtascha, Seka Ksharodakenava, Prachadaya मांसपेश्या वा कृमीन् अपहरेत् व्रणात् विंशति कृमिजातेस्तु वक्ष्यामि उपरि भागशः. So when bandhana is not done, the wound gets exposed to dust or it gets infected, and the organism brought by flies or krimi will be formed inside, and it will sit on the wound and produce various complications like severe pain, swelling, discharge, etc. The eggs laid by the flies will develop into maggots, and that also will result in different complications. For cleaning this, Shodhana, Kalka, Churna, etc. mentioned before can be used, and it is told like if the krimi are large and visible, they can be extracted by using instruments, fingers, or by keeping a bolus of meat over the wound. That is, the krimis will get attracted to the mamsa peshi, and thus by using that kind of bolus of meat, it will help to remove the krimi over the wound. And then for other than that, for cleaning the area, Ksharodaka can be used, or lepa of Saptaparna, Karanja, Arka, Nimba, that can be applied along with Gomutra. These all will help to remove the krimis, and it is told like Vimshitin Krimijatis. That is, whatever types of krimis mentioned earlier, all those krimis can be removed by the application of these kind of procedures. Either it can be the Shodhana, Kalka, Churna, etc. mentioned earlier, or the Lepa of Saptaparna, Karanja, Arka, etc. Then washing with Ksharodaka, and if it is large and visible, it can be extracted using different kinds of instruments or with the help of fingers. Or else we can keep a bolus of meat over the wound, by which the krimis get attracted to that, and thereby it can be removed from the prana. That is Krimikna Karma. Next is Brahmana. Dirghakaladuranam tu kushanam ranashoshinam brahmaniyo vidhik sarva kayaknim parirakshata. It is all types of Brahmana therapies have to be adopted when a person is suffering from the disease for a long time. Therefore, he has due to complications of Prana, the patient is weakened. In such cases, Brahmana therapies can be adopted. All Brahmana drugs and therapies that have to be adopted only by taking care to protect the kayagni of the patient. Kayagni parirakshata. So whatever Brahmana therapies we are or Brahmana drugs we are selecting, at the same time we have to take care to protect the kayagni of the patient. That is Brahmana. Then Vishakna. Vishajustasya vijnanam vishanishchayamev cha chikitsatam cha vakshyami kalpeshu pradibhagasha. So when the vrana is complicated or not healing because of the presence of visha or toxins, then different kinds of agada needs to be applied locally as well as given internally. This agada, lepa, and pana can destroy the visha locally and systemically, or the pathogens, if it is present locally, that can be removed with the help of this agada, lepa, and pana, and thus it will improve the general condition of the patient as well as it will help in healing of the wound also. Chikitsitam cha vakshami kalpeshu, that indicates the different kinds of agada to be used in this condition. Next is Shiro Virejana. Shiro Virejana Kandu Mandasa Shofascha Yecha Jatru Parivrana Shiro Virejanam Teshu Vidadyat Kushalobhisha. That is the prana which is situated in the regions above the Jatru, above the clavicle, and those prana which is associated with itching and swelling. In that condition, Shiro Virejana is advised. Next is Nasya, Rujavanto Anilavishta Ruksha ye च ऊर्ध्वजत्रुजा व्रणेषु तेषु कर्तव्यं नस्यं वैद्येन जानता. Nasya is indicated in Vrana, which is situated above the clavicle, Vrana which is associated with the Visheshan of Vata, then Vrana which is painful and which is Ruksha. In such condition, Nasya can be given. Then Kavalagraha, it is told Dosha Prachyavanarthaya, Rujadaha Kshayaya cha, Jihvadanta Samuddhasya, हरणार्थं मलस्य च शोधनो रोपणश्चैव व्रणस्य मुखजस्य च वै उष्णो वा यदि वा शीत कवलग्रह इष्यते. Based on the roga, rogi, dosha, etc. Ushna or shita kashaya or taila or krita etc. can be used for the purpose of kavala dharana. This will help in the shodhana and ropana of the vrana situated in the oral cavity and reduces the pain, burning sensation, remove the coatings of teeth, gum, tongue, etc. Next is Dhumapana, Urthajatrugadan Rogan, Vranashta Kapavadajan, Shofasrava, Rujayuktan, Dhumapane Upachare. That is Dhumapana with Dhuma, smoke of various ducts, which is indicated in Vrana, situated in Urthajatrugata Pradesha. Vrana due to vitiated kapha and vata, Vrana with excessive discharge, swelling, pain. These conditions can be treated with Dhumapana. Then it is Kshaudra Sarpi. Kshaudra Sarpi, Kshatoshmano, Nigrahartam, Standhanartam, Dhadevacha, Sadhyo Vraneshu Ayataneshu, Kshaudra Sarpir Vidyate. That is application of combination of honey and ghee. That is done to reduce the Ushmata produced by an Abhigadaja Vrana, causes the Sandhana of Abhigadaja Vrana, and thus promotes the healing. Kshaudra Sarpi or Madhu Sarpi. Then it is Yandra. Avagadastu Anumukha, Ye Vrana Shalyapedita. Nivritta Hastodharana Yantram Teshu Vidhyade. That is when, for ensuring proper healing of Rana, one has to use instruments to, like instruments in the form of Yantra Karma. That is in deep seated ulcers, ulcers with narrow openings, and in ulcers with foreign particles. In that condition, that cannot be removed by bare hands, Yantra can be utilized. Next is Ahara, Lekhumatro, Lekhushaiva, Snigdha Ushno, Agnidipana, Sarva Vranibhyo Deyastu Sadaharo Vijanata. That is, wholesome diet should be advised to a patient for the proper healing of the ulcer, minimal scar formation, and for prevention of recurrence of the ulcer. And the food should be Lakhu, Snigdha, and Ushna and Guna, and it should cause Agnidipana. Such kind of ahara have to be advised. Next is Raksha Vidhana, Nishacharebhyo Rakshastu, Nityameva Kshatatura, Raksha Vidhane Ruddishtet, Yamai, Saniyamaistada. That is, even after the healing of Rana, as the site is fragile, the patient is advised to take wholesome food and regimen, various Raksha karmas in the form of reciting hymns, various rituals. Means by doing that, the patient have to be protected from krimi, rakshasa, etc. That is, it is a point of view that is preventing the reinfection of the wound site and preventing the wound dehiscence as such and preventing the recurrence. For these kind of things, even after the procedures, we have to take care of patients by doing different kinds of rituals or hymns etc. have to be chanted. That is the Raksha Karma or Raksha Vidhana. So that is about the Shashti Rupakrama. Then it is told about Apatya, that is Divaswapna, Maithuna, Vyayama, Ratri Jagarana, Navadhanya, Kshira, Amla Lavana Katurasa Pradhanahara, Vistambi Guru Shitala Vidahara. These are considered as Apatya, are the things that have to be avoided in Prana Avastha. Then Pathya, it is told Godhuma Shastika Shali. So for Pathya, it is told Jeevnashalyodanam Snigdam Alpam Ushnam Ravotaram Hunjano Chankalir Mamse Shikram Ranam Apohati Tanduliyaka Jivanti Sunishanaka Vastukai Balamulaka Vartaka Patole Karavelaki. That is the in the diet we can include Yamagoduma Shashtigashadi, then Jivanti, Balamulaka, Vartaka, Tanduleka, etc. That will be beneficial for the Rogi who is afflicted with Vrana. Then in the Vranitopasaniya chapter, you have been familiar with the Vranitakara concept. That is told that a recovery ward or a Vranitakara should be maintained for the patient of Vrana, and that should be built in a spacious place according to the Vastu Shastra. It should be well ventilated. It should be free from dust, cold wind, direct sunlight, etc. It should have a comfortable bed with a pillow, and the patient should means it should be lying or facing the east. Then weapons for the patient on means whatever necessary for the patient as well as the attenders that have to be present in the Vranitakara to protect the patient, and the patient should be attended by well wishers. So that is the concept of Vranitakara tool. The next is about the Sadhyo Vrana or Akanduja Vrana or Abhigadaja Vrana. That is the Vrana which is caused suddenly due to Abhigada or trauma. So when we see the Bheda based on the different shape, it is told Ayatas Chaturasrasya Tasya Mandalinastada Arthachandra Pratikasha Vishala Kutilastada Sharava Nimna Madhyascha Yava Madhyastada Pare Evam Prakarakrateo Bhavanti Agantavo Prana. That is, it can be elongated, four-sided, triangular, circular, semicircular, wide, irregular, saucer shape, that is depressed in the center, Sharava Nimna Madhya. Then barley shape, Yava Madhya. So like that, different kinds of shape. Based on the shape, these are the elongated means Ayata Brana, Chaturasra, that can be four-sided, Tesra, triangular. So based on the shape, these are the types told. Then the classification is Chinnam Bhinnam Tadha Vidham Kshatam Vichidamivacha Krishtamahusta Shashtam Desham Vakshyami Lakshanam. So Chinna, Bhinna, Vidha, Kshata, Pichidan, Krishta. Sized wounds, incised wounds, punctured wounds, lacerated wounds, crushed wounds, and abrasions. So first is Chinna. Chinna it is told Tirashchina Rajurvapi Yo Vranaschayato Bhavet Gatrasya Patanam Chapi Chinnamityubadishyate. That is a wound which is brought caused as a consequence to separation of a part from the rest of the body. Chinna, excised wound. That is Chinna Vrana. Then Bhinna it is told Kunda Shakti Rishti Khadga Agra Vishanadi Virashaya Hada Kinchit Sravetati Bhinna Lakshana Muchade. That is because of the trauma due to sharp objects like spear, trident, or knife. What happens? There is an incision to a body part or a viscera that will result in discharge or exudation. That is called Bhinna Vrana. And Bhinna Vrana, it is told like based on the means when koshta is bhinna, if it is getting filled with blood, then it can result in fever, burning sensation, loss of consciousness, dyspnea, or there can be bleeding from urethra, anal canal, or oral cavity, or epistaxis, bleeding from nose. These kind of features will be presented. Then when the amasya is get filled with ruthira, then hematemesis, blood vomiting will happen. When it is caused, when the pakwasha is filled with blood, there can be pain, abdomen, heaviness, coldness, etc. Melena or hematuria also can be presented. Then it is about Vidha. Vidha Lakshana, Sukshma Asya, Shalya Abhihatam, Yadangam Tvashayad Vina, Uttundidam Nurgadam Va Tad Vidhamiti Vinurdishe. That is when a foreign body having narrow or fine tip punctures the body other than what happens? Either it gets retained or falls off. Then the wound caused is called Vidhavrana. That is punctured wound, Vidhavrana. Then next is Ksatavrana. Ksatavrana it is told Nadi Chinnam Nadi Bhinnam Ubhayor Lakshananvitam Vishamam Ranamangeyatat Kshatam Tva Abhinardeshet. The wound which neither looks like an incised wound nor an excised wound. That is, it is having mixed features of both. That is irregular in shape. Vishama Ranamange. and then it is called as Ksatavrana, that is a lacerated wound. Then Pichida, Prahara Pedanabhyam tu Yadangam Rududam Gadam Sasti Tat Pichidam Vidyan Majjarakta Varipudam. That is because the excessive compressing force, when the side becomes widened or swollen, damage mixed with discharge of marrow mixed with blood, and just defined Pichida Vrana, crushed wounds. Next it is Krishta, Vigadatvagyadangam hi Sangharshat Anyadhapiva Ushasravan Vidam Tatu Krishtamityubadishyate. So when due to rubbing or friction of or because of any other cause, the skin gets peeled off from the underlying tissue, then it is causing burning sensation and discharge. Ushna Sravanvidam. So blood or serous discharge. Then that wound is called Krishtavrana. Can be related to abrasions. So next we will see about so these are the 6 types. Sadhyavrana, Chinnam Bhinnam, Tadhavitham, Chinnam Bhinnam, Tadhavitham, Kshadam, Vichchidam Evacha, Kushtam, Ahus Tada Shastam, Tesham, Vakshyani, Lakshanam. So these are the 6 types of Sadhyavrana. Lakshana we have seen. Next it is about the treatment. So for treatment in general it is told in Chinna Bhinna Vidhan Ksatavrana, there is excessive blood loss